his daughters were fighting in the house. He had to run up the stairs. Oh, you ran up the stairs? Your knee didn't hurt? He said, oh, really? Yeah, my knee didn't hurt. So sports injuries can be from professional athletes or from people who are just very active playing sports. And if you play a lot of sports, you tend to get injured. Then if you get injured, it takes time for the injury to heal. Usually for people in their 20s or 30s, they can heal faster than when you are in your 40s to 60s. If you don't take enough downtime to let the injuries heal, then you can build up the injuries repetitively. Then that's when the problem can become chronic. For example, we had professional baseball players who have retired, but because during their playing days, they put a lot of toll on their body. Then after they retired, they would have a lot of joint issues from the past injuries. One baseball player we treated is Eduardo Perez. He is also the ESPN announcer and also the host for Sunday Night Baseball. He already had one knee replaced, and the other knee, he had meniscus surgery. Again, he already had multiple surgeries on the other knee that he didn't have any knee replacement. He had prolonged pain even 2 months after the surgery. Then he said it wasn't normal because he already had meniscus surgery in both knees multiple times. And he said he never had that problem, and he was limping. So that's when he sought out stem cell treatment because his surgeon said everything looked fine to me and he didn't know what else to do for him. And he didn't want to have another knee replaced. Many people after knee replacement, they still have a lot of issues with the replaced knee because the angle or the space for the replaced joint can be not perfect, then you would still have pain. So he said he wanted to try stem cells for that particular knee that he had a lot of problem post meniscus surgery. And he had the stem cell treatment with 50 million cells and his platelet-rich plasma. So after about 3 weeks, he said his daughters were fighting in the house and he had to run up the stairs, and he wasn't able to do that before. But it was his wife who reminded him saying, oh, you ran up the stairs? Your knee didn't hurt? He said, oh, really? Yeah, my knee didn't hurt. So that's what happened to him. But we also treated people who are in their 30s, 20s, playing basketball, and then they already wear out their cartilage. If you use the stem cell treatment to help them rebuild the cartilage, then they would not have a lot of pain playing, and they could still play very intensively.